Hello, my dear students. Last week, we are done with our discussion on the parts and functions of the digestive system. Today, we will be discussing the common diseases of the digestive system, its causes and symptoms, prevention, and treatment. Let's have a short trivia. What is the medical secret to Mona Lisa's smiles? Are you familiar with Da Vinci's painting of Mona Lisa? Forget the smile. Mona Lisa's eyes reveal a penchant for fatty foods. According to Dr. Vito Franco from Palermo University, she shows clear signs of a buildup of fatty acids under the skin caused by too much cholesterol. Cholesterol is a solid lipid molecule which may accumulate in our skin. It also suggests that there seems to be a lipoma or a benign fatty tissue tumor in her right eye. So let's proceed to the digestive system. Diarrhea. It is characterized by abnormally loose or watery stools. What are its causes? It may be caused by a bacteria, viruses, parasitic organisms. Its symptoms may include stomach pain, blood in the feces, vomiting and nausea, fever and dehydration. What are the possible treatments? Take oral rehydration solutions, zinc supplements, and antibiotics. Eating foods high in soluble fibers such as banana, oatmeal, and rice may help thicken the stool. However, if symptoms persist for more than 3 days, you may consult a doctor. Let's move on to colon cancer. It refers to a clump of malignant cells formed in the intestinal wall or colon. What are its causes and symptoms? It is caused by a mutation in the cell. Its symptoms includes persistent change in the bowel habits, blood in the bowel, fatigue, persistent abdominal discomfort, and unexplained weight loss. Prevention. Lifestyle changes to reduce your risk of colon cancer by eating a healthy diet, avoiding cigarettes and alcohol, exercise, and maintaining a healthy weight. Detection and treatment. Colon cancer screening, radiation therapy, drug treatments, surgery, and immunotherapy. Let's move on to the next, constipation. It refers to a difficult bowel movement. Its causes include lack of fiber in the diet due to the weak muscles in the digestive system. Symptoms: difficulty in passing out waste, feces that are hard, dry, and lumpy, and less than 3 times a week bowel movement. Prevention and treatment: eating fruits and vegetables high in fibers, more fluid intake, exercising more, and drinking stool softeners and fiber supplements may help. Let's move on to heartburn, or the GERD, or the gastroesophageal reflux disorder. The digestive juices from the stomach moves up the esophagus. What are its causes and symptoms? Weak muscle of the lower esophageal sphincter, the burning sensation in the chest, difficulty in swallowing, regurgitation of sour liquid, and inflamed esophagus. Prevention and treatment includes changes in lifestyle, antacid and medications that blocks acid production, and surgery. The next digestive disease is the appendicitis. It is an inflammation of the appendix. What are its causes and symptoms? Bacteria causes the inflammation of the appendix. Symptoms may include pain around the navel and the lower right abdomen, nausea, vomiting, and fever. Abdominal bloating and flatulence may also be experienced. Detection and treatment. It is better to consult a doctor for medication, undergo some lifestyle changes, and you may undergo surgery. The next digestive disease is the peptic ulcer. It refers to an open sore in the stomach or in the intestinal lining caused by the over-secretion of digestive chemicals. Causes and symptoms. Infection with the bacterium Helicobacter pylori and the long-term use of non-steroidal anti-inflammatory drugs. What are its symptoms? Feeling of fullness, bloating or belching, intolerance to fatty acids, heartburn, nausea, and the burning stomach pain. What are its detection and treatment? Endoscopy and biopsy may be required to check on the ulcer. A treatment may also include killing the Helicobacter pylori, eliminating the use of the NSAID, and antibiotic medication. Let's move on to the next digestive disease, celiac disease. This is an immune reaction to eating gluten. It is a kind of protein found in wheat, barley, and rye. What are its causes and symptoms? Eating food with gluten, a person may experience diarrhea, fatigue, weight loss, abdominal pain, and vomiting. It is characterized by inability to absorb nutrients because there is an inflammation in the small intestine. Detection and treatment includes blood testing and endoscopy. And a strict, lifelong, gluten-free diet is the only way to manage the celiac disease. For digestive disease, we have the irritable bowel syndrome or the IBS. It is a chronic disorder affecting the large intestine. What are its causes and symptoms? An infection in the intestine and changes in the bacteria found in the gut. Cramping, abdominal pain, bloating, gas and diarrhea, or constipation, or both. Detection and treatment. Consulting the doctor if there is a persistent change in the bowel. And lastly, for treatment, progressive relaxation exercise may be undertaken by the patient, or she may undergo counseling and mindfulness training because this disease is somewhat stress related. Thank you and good morning.